The second of these special points is on the governing meridian. This meridian runs up the spine over the head from the pelvis, and there's numerous points on this meridian, but this one special point is called Do 14. It's special because it's extremely potent if you have asthma, if you have coughs, colds. So it's very, very potent point at calming the lungs down and clearing all of that irritation, calming the irritation and then opening. Because it's at the top of the chest, it helps to the expansion of the ribs and the chest to allow the lungs to actually work in their format. So if the virus has already entered the lungs, we need to bring it out. So this point is very special because not only does it bring it out, but it also raises your chi levels. Chi means energy, so your energy levels raise, and we talk about a protective layer. So if you don't have the virus, this point also helps the body protect itself from viruses. So we often see in a room full of people that when the flu's around, that some people get it and some people don't, and it's the same with the coronavirus. That some people get it, some people get strong symptoms, and some people just carry on as though they don't even know they've got it, or they have very mild symptoms. So this point is extremely good for bringing it out. Now, it's just below the seventh vertebra in your neck. So the way we find this is that you tilt the head forward and then you reach to the back, and you'll feel as you go down the neck, you'll feel one vertebra is sticking out, and that is usually C7. And this point is below that vertebra. So it's a bit awkward for you if you're working on your own, but what I would suggest you do, and I'm always going to suggest you use all fingers at the same time, because then you always get the point, you're not missing anything. So if you reach over, if you place your fingers like this so they support each other, it means you can press a little bit harder into the area. So tilt your head forward, go down the neck, find that bone sticking up, go below it, and then you should feel that there's a little bit of space and probably some bruised feeling, some tension, and just lift your elbows up and down. So what I'm doing is I'm pulling forward and I'm lifting one elbow up and down. So actually the vertebra's being moved ever so slightly. And then you can just push it forward and then rub across the point. Keep pushing, keep rubbing, turn your head as you're doing this, because it helps to emphasize different imbalances in the ligaments and the muscles. And what we want to do is we want to clear this blockage. If there's a blockage there, then it's going to influence all sorts of things. In core therapy, we recognize this as the thyroid bone. So when C7 and T1 are blocked, which it always is on everyone with a thyroid problem, then I don't know, does it come before the thyroid problem? Does it come after? That's up to the researchers to decide. But also, if you have asthma, you'll find that those top four vertebrae are all blocked as well. So it means that there's no clear movement of the chest and the breathing. So this point here, just reach over, rub it as much as you can, go back up to gallbladder 20, rub that back down, and again, a few minutes or until your arms get tired, whenever you can. One of the things you can also do here to make it easy for yourself is take 2 tennis balls and put them into a sock, tie them nice and tight together, and they'll sit like this. And you can place them on either side of the vertebra, or you can place them vertical, so they're actually pushing on the vertebra and helping the vertebra move their position. Movement, flow is health. If there's any blockages or restrictions, that's when we get ill health. So we see it all the time in our clinics. You can work at this yourself.